Can you all hear us? All right. Buenos dias. We're pressed for time, so we're just going to get right into this panel. We have information in your package about the speakers here, myself, the moderator, and you'll see stuff about us on the screen here. This is a very important topic because of the pandemic has really exposed a lot of health inequities in our communities. Prior to the this crisis, if you will, there was already too much inequities in our community, especially as you saw the numbers increasing over the last 20 years. Prior to the pandemic, Latinos still had a lot of challenge in the health field, lowest insurance rates, younger chronic illnesses, and so forth. So now, as we look to the future, and now the pandemic's sort of waning, not officially over, what are the challenges that we're facing moving forward? So we have three distinguished speakers here from the state of Minnesota that are going to lead us in sort of the conversation and so forth. So I am going to start off with Rosa to maybe just start the conversation about what are the challenges here. You're from Minnesota. What are the challenges in the region that you've seen, particularly during the pandemic, and what's being done in the region to address some of these inequities?
Muchas gracias. Buenos días a todos y a todas. It's a real honor and pleasure to be here with you and with these distinguished panelists, including my paisana Guatemalteca, Ruby. So Guatemala is in the house, yeah, another commercial. So to respond to your question, there's little research actually around those issues in the Midwest. And I was kind of excited this morning because we were going to hear a little bit more of data regarding the Midwest itself. And so the little research that I was able to find around what are those challenges and those barriers, including for the pandemic, the little research that I was able to find point to very similar trends and very similar issues that as a state council for the state of Minnesota, we are a state government agency, and we are a bridge and we connect the communities in Minnesota with the state legislature and state government to provide policy recommendations and legislation and other issues that are important for the community. And we have every legislative session an agenda that is pretty much informed by the community through listening sessions that we conduct, particularly in greater Minnesota. And so they are very consistent with Minnesota as well. And those have to do, and I think that Rodolfo mentioned some of them, they have to do with the lack and limitations in health insurance coverage, the high costs of health care services, the communication issues between providers and the patients, that has to do with language barriers and the lack of enough interpreters, particularly qualified interpreters to serve to these patients, particularly immigrant Latinos, and also transportation concerns. And that's something that the CEO of 3M also mentioned this morning about how difficult it is, particularly in greater Minnesota, to get to a health clinic, to a hospital, because of the distance. So those four issues have been also been told to us by the community when we do those listening sessions. So when we started re-engaging with communities across the state, the two main issues that they mentioned, again, were the lack of health insurance, the lack of health access access to health insurance, and also the need for more and better trained medical interpreters. Latinos in Minnesota, 22% of them lack health insurance. It's the highest percentage for all demographic groups in the state of Minnesota. And it's very reflective also of the percentage nationwide. For instance, I read an article after the horrible shootings in Uvalde that were describing the need for communities to get mental health services and care, but at least 22% of the community in Uvalde also lacks health insurance, and how difficult it is then to take care of those issues. But the underlying factors, I would say, of all of these challenges in these areas, the underlying factors are the inequities. And I think that we've been talking about a lot about health equity in the state and addressing the root causes of these inequities and also the social determinants of health that I believe one of my colleagues here is going to talk later. But they need to be fully addressed, those social determinants of health, because those have to do with what kind of jobs and what kind of good paying jobs our communities access to, because that's part of it. Do they have healthy food options? Do they live in food deserts, for instance? And what is out there to address those? Parks and open spaces, quality education, all of those are also part of what makes communities healthy and thriving, and those need to be addressed as well. And finally, I would say that structural racism needs to be also named, and this is also a factor that contributes to the poor outcomes of many Latinos. According to the new Assistant Commissioner for the Bureau of Health Equity for the state of Minnesota, racism is one fundamental cause of diseases that could be preventable. So we need to really examine our policies, our structures, how those interact. And as you mentioned, the pandemic just made more visible those disparities and how they were exacerbated, particularly for essential workers, many of whom already suffer from unequal access to healthcare, as I mentioned, other kinds of chronic diseases, and more mental health issues, particularly among our young population. So we need to also see how those issues are more palpable in the intersections of health, physical, gun violence, and even healing. So I will leave it up there just to
Thank you,
start
Rosa.
the conversation.
This morning we've heard about all of the gains and contributions of Latinos across the country. And here in the state of Minnesota, its labor force, its growth, and the pictures about the mole de Puebla and the tacos and so forth. Lots of contributions, but yet there's been a lot of challenges. This particular area has been one of them. Jonathan, no one organization can address these challenges. How are stakeholders working together address this, and what additional stakeholders are needed to address the challenge of inequities in this healthcare field?
Good morning, everyone. I think I would say something that is very important in the work that us nonprofit organizations are doing is receiving those resources from the grant funders. So on one end, I think that is one of the stakeholders that are super, super important in the work that we're doing. Also, I would have to say the employees. I think that those employees that were consistently providing those initiatives that work for the health and well-being of the population we serve is very important. So that would be to answer the first part of that question. To answer the second one, I think it would be very important for us to create more alliances and partnerships with government agencies just to further amplify our purpose and our voices and have a bigger possibility of doing a bigger outreach to more communities.
Thank you, Jonathan. Ruby, you've been doing this work for years, and at CLUES, it's certainly an organization taking the leadership in this space. Most recently, you sort of did your own identification of the social determinants of health. Could you share with us what are they and how you're approaching this work?
Sure. Buenos días, todo mundo. Good morning, everyone. Yes, first I'll provide some context for those who don't know about there's a pie chart, and unfortunately I had visuals, but we couldn't get them up there. But if you picture a pie chart, and what it tells you, according to the State Department of Health and the Center for Wellness, 40% of your well-being. So think about it in a micro level, on an individual level, and then as a society for the Latino community and the macro level. So this is how we do our work at CLUES. 40% of your well-being is focused on your social and economic environment. 30% is based on your health behaviors. So in healthcare access as well. So if you think about it, 70% of your well-being is surrounded by these two emerging pieces. Only 10% is based on your environment. You know, if you don't have parks in areas where people can go walk or bike. In Minnesota, we're very proud of our parks and green areas, and certainly corporations is one of the big things they sell, right, to employees. 10% is genetics, and if you have obesity or high blood pressure in your family, well, that will impact your wellness, your health care. And so when you think about the 70%, that's how we do our work at CLUS. Our work is holistic, multi-generational, and is interconnected. We provide the services that help bring community, meet them where they're at, so a person can come to the organization because they lost their job. And not having an income is providing stress. And we have clinical behavioral health services available. We have social workers that are also providing in-home services for families and parents in particular to go see what are those behaviors, what is the environment that they live in. With the pandemic, housing, access to food, cultural food, and healthy food. Of course, many of our people live in food desert areas. Many of our people live in childcare desert areas. So those are barriers that are impacting not only your socioeconomic mobility or ability to be stable, but also impact the levels of stress, chemical health, all those services. So what we do at CLUS is we provide not only the bilingual, bicultural services where we're able to, and we try to foster that work in other nonprofits and bring a voice to the table. The one thing that we added in addition is kind of our theory of change, which really adds value to or our value proposition, if you want to call it that, where we believe that bringing people together, providing networks of support, providing spaces for people to engage in a cultural way, also provides value, empowerment, and it provides a sense of belonging to many people in our community, to each of us. I'm an immigrant, and although I came here more than 40 years ago, I still need my community, and I need my tortillas, and I need my, the places that make me feel like I'm at home. That's what we try to do, and I think for many corporations too, where I have seen as they recruit people from outside the state, it's also important to think about what are we providing to support them in all these other ways, socioeconomically, but also community-wise. And certainly arts and culture are a piece of the work that we do, where we say that la cultura cura, or culture helps you heal. And that's one of the big pieces, besides the clinical services that we provide at CLUS.
Thank you, Ruby. Rosa, you mentioned some of the issues that are barriers that are facing the community here in the region in Minnesota. So as you look forward, what needs to be done collectively to across the sector and industries to address these inequities that, again, we all, on principle, agree that they started before the pandemic. They just got exacerbated after the pandemic.
Yes. I think that Ruby mentioned some of them, when she mentions community. And those solutions need to be community-driven. I mean, they need to be found where the issues are and where people have a stake, particularly in their localities. So they should be also focused on the development of health education and health promotion and prevention interventions, but that they recognize these barriers and how they are unique to Latinos in those communities, and not every community is the same. So not one recipe is gonna work for all of these communities. As it was the theme of this summit, we need to recognize the nuances. And I think that the data also gives us those nuances and a guide for this, for the design of these interventions that have to also take into account the unique attributes or characteristics. So those interventions need to be grounded in the values, the beliefs, the norms, the culture, what's already in those communities. And that also includes a healthcare workforce that also reflects the patients that they treat. So that comes with the recommendation or the strong advice that there needs to be more encouragement and investment for young people to also choose STEM careers, to be doctors, nurses, physicians, etc. Then there needs to be a multi-sectoral collaboration, and I think that you alluded to some of them, including corporations or businesses that have these kinds of innovative solutions, and companies like 3M, but that also needs to include government and the local public health entities. And most importantly, those solutions need to be evidence-based or evidence-informed solutions and very bold public policy. So the government still has a great role to play in leveraging all of already the resources that there might be in the community, or the foundations, that the nonprofits, that the businesses bring, but the state, the government still has a big role to play, particularly in addressing those root causes that we were talking about. And there are other policies that need to also be taken into account and restructured. And those have to also do with the social determinants of health. So looking at the taxation policies, is it fair taxation, progressive taxation? Income inequity, how does the government address those? Housing, the justice system, education, urban planning. So those are some of the other roles that the government also needs to have a stronger say on it. And that's why the participation of the community in being at the table, in also advising in policy changes and system changes, is vital. And finally, we don't want to think that there's not some hope out there, but as Claudia Romo was saying this morning, we need to start shifting that narrative of scarcity to one narrative of assets, and how our communities, how we are also assets in the sense that we have resilience. There is resilience in those communities and individuals and organizations based on strong family and community bonds. And there's also trusted leaders and institutions in these localities, particularly when we think of communities of faith, when we think of the nonprofits, when we think of the informal networks that exist in those communities, volunteering groups, civic groups that come all together. So there's already assets there, and we need to identify them to build on those collaborations.
Thank you. Jonathan, you mentioned earlier that the private sector, the philanthropic sector, the government sector, the nonprofit sector, it's no one stakeholder or sector can address these challenges. They all need to be working together. Can you share some vivid examples of what you've seen or what needs to happen so that all these sectors are working together to address these challenges?
So like I mentioned before, it is very important for multiple leaders to work together alongside the community to address these issues and create networks of support that promote and foment the health and well-being of the communities that they serve. And actually, there is right now an initiative specifically that's for queer youths that we are participating alongside with 5 other nonprofit organizations, including Clues. And we created this initiative to provide education to parents as far as gender identity goes, everything that has to do with the queer community, to better understand their children and their kids that are part of the queer community and have a space of acceptance, a space of inclusivity, and a safe space for them. Because we know that if we're gonna talk about health and well-being, we need to also talk about creating inclusive spaces for the people that belong to the queer community. I myself am a homosexual, and I know how important it is for us Hispanics to have these conversations and this narrative. So that is an example that I can provide for this question.
Thank you. Ruby, I'm not surprised by what you mentioned. It's at least 70% you identified, if I understood you correctly, social and economic and health, direct health are the issues. As you think about moving forward, what needs to change? What needs to be done differently to really address those root causes? Or we definitely have to figure out ways of approaching this, especially now after the pandemic.
I think I'll frame it a little bit around the transformational work that we are attempting to do. And I think as a community, as a broad community, when we look at the macro level, for me, it's three things. Changing narratives, and there will be some conversation later around that. But changing narratives is kind of where so all three are changing narratives, changing behaviors, and changing systems. And, because the root cause of a lot of the barriers that our community encounters and the lack of opportunity are based on the systems, right, and the inequities. 45% of the total Latino population in Minnesota are under the age of 19, yet not a lot of investment in education or career pathways for young people. Not a lot of investment in technology access for young people. We have also, Latinos have the highest labor force in the state, if not the highest, one of the highest labor force, and yet one of the lowest wages in the state. When it comes to housing, the per capita housing ownership or home ownership is high for non-Latinos or non-BIPOC communities, yet for BIPOC communities, we rate at number 49 or 50 probably at this point. So the racial inequities and the disparities that our community are facing are definitely systems that need to be addressed, whether it's workforce, whether it's access to healthcare. In our behavioral health, everybody talks about the need for mental health services, but there's very, very few dollars invested in those services. Nonprofits, I think, are not also engaged in this community development piece, and we need to include nonprofits at all levels. I see some change now happening in this administration, which is very positive. But when it comes to changing narratives, it's not just changing the narrative that Latinos are great consumers, because that's the narrative that we hear, but it is about the voice of our young people, the voice of the diversity of our young people. How do they want, this is their country, this is their future. How do they want to be the next workforce? How do they want to be the next leaders, the next elected officials? So it's important that we start investing now in building those seeds so that we can write, greater efforts and inclusivity, true inclusivity, authentic diversity, as we have many diverse groups in our community. And I think partnerships, where we have public-private partnerships is also another way. Going to the legislature and asking for systems change, not just for money, but systems change, looking at addressing those inequities.
Thank you, Ruby. In a minute, we'll open it up for some questions or comments from the audience. That's a very important topic. Rosa, again, the contributions of our community have been augmented this morning, and we continue to be a community that's contributing. Yet sometimes the perception is that we're takers. We contribute to the economy, we contribute to the labor force, we contribute to the culture, we contribute to the social fabric of this country, and so forth. So what do we need to do different for the rest of the population to recognize that, and also recognize that we will be contributing as well to this issue from our own personal responsibility, trying to get better and so forth? What would, if we were to avoid another crisis in our community because of the inequities that exist, what would we need to do differently moving forward?
I think that two things, and some of those solutions and some of those ideas were already shared here by my colleagues in the panel, but I would say that systematizing and making sure that we have learned the lessons of the pandemic is very important, and so research is very important, and my call of action for this summit and for the leaders here and for the leaders in the region is about the importance of having good, sound research about those issues in Minnesota, but also in the Midwest, and so that we can learn exactly how we can prevent. Because as we were mentioning, I think that all of this can be preventable. It's just that the systems, and particularly when it comes, the pandemic was a public health issue, so I think that that's where I think that the role of government is so essential. And so one of the things that we learned during these two traumatic years, in addition to other situations of violence that the Twin Cities experienced after the killing of Mr. George Floyd, is the importance of the state needs to have a way to provide accurate, timely, and multilingual information to be able to know what to do in these kinds of cases. And it took a long time for the state of Minnesota to realize that those multilingual services are needed also from government at all levels. I think that that's one of them, and that would have prevented many things and would have guided communities, that are Spanish-speaking communities, to get the resources, to get the proper information about the tests, the proper information about the vaccines, and many other issues. So that's one thing. And the other, if I may, is the importance to also fund rigorous scholarship in the region, in the Midwest region, so that we have a good understanding with evidence, with data, with numbers about the different trends and the different issues that are faced and the trends that are there, so that we can also inform policymakers about those best practices and about the needs of these communities, in particular those that you mentioned, the contributions of Latinos in the Midwest and in Minnesota, and how important it is that the government reciprocates back, because, as we were saying, I mean, we contribute enormously in the economy and in the fiscal base of the state and in the Midwest and in the nation and around the world. So there is this sense of reciprocity that is needed also in government.
Thank you. Jonathan, earlier we heard that the growth of the Latino community is not through migration anymore. Is through birth rates, and we're one of the youngest populations in the country, and here in Minnesota, the figures show that as well. What is your call to action to young people in terms of moving forward and holding policymakers and private sector and others accountable to address the challenges that our community is facing in this issue?
My call of action for young people, I would say, is to become leaders and to take up space. The work that we're doing is for them to be better to provide to our society. So I would say for them to not to be scared and to take up space, be the leaders that they want to be.
Ruby, again, if CLUS has been doing incredible work in the state of Minnesota, not just in the Twin Cities, and you continue to grow. You mentioned resources are important, but it's not just about resources, the type of resources and the type of partnerships and the type of alliance. What is your call to action to policymakers, private sector, and other allies to continue to address this issue?
For policymakers, is investing in our community. As we look at the numbers, it tells you the story that we are the future of this state. We are the future of this country. It's now. It's not tomorrow. It's now. But the lack of investment, I think, in not just, again, not just money, but lack of investment in looking at what are those transformational pieces that we need to work together in changing. Those approaches that are holistic, that include multi-generations, are important as well. Not just, we're working with youth. At the same time, what are the bigger stressors for them? The economy, helping their families survive. Our undocumented community has been left behind. And we have a large number of undocumented families and underinsured and uninsured families. During COVID, that was exacerbated, where the stressors became the big pressure for young people, because they were the ones that families depended on to bring bread to the table. And so we were not prepared in terms of access Our undocumented community did not get any helplines as many others received. So we as a nonprofit, many of us had to go raise our own funds to help the families that were not getting any cash assistance. So we were definitely not ready, and I think this COVID in the coronavirus has been teaching us a lot of lessons in what we need to invest as a community, because these are our neighbors, these are the families that, we are part of the bigger Latino community.
Thank you. I'm just going to try to synthesize here and sort of add my call to action as well. As we continue to hear this morning, and we'll continue to hear through these summits throughout the, ongoing. It happened in Texas, happened in New York, now it's happening in Minnesota, is to really elevate and change the narrative of our community. Even though the numbers reflect that we're growing, that we are making a difference, changing the landscape, contributing more to the economy, the social fabric, and so forth, we have yet to be recognized in a way that we can exercise our power to do so. So for young people, I guess one of the questions is, the majority of the growth in the Latino community is birth rates. That means there are US citizens. That means they're ready to vote. They're ready to exercise their vote. I myself, as an immigrant, have 3 kids. They're all born here in the United States. My son voted for the first time in the presidential election last year, 2 years ago, and my daughters will be voting for the first time in these national elections this year. So one of the call to actions is, how do we mobilize our community? The last national elections, as I understand it, and correct me, Mr. Andrade, if I'm incorrect on this data, is that even though Latino vote increased significantly, there were still more Latino voters that were eligible to vote than voted. And that is sort of to address these issues of more government funding, holding the private sector accountable, holding the philanthropic sector accountable. We need to exercise our collective power, not just in the political arena, but also in the economic arena, and clearly, as we become more professionalized in the health space as well. So it's not just the needs, but building on the assets of our community, tremendous assets in our community as we move forward. So let me ask you to give a round of applause to our panelists here. And thank you, everyone.
Thank you, everyone.